The Health System Strengthening Program is an initiative by the Ministry of Health and Wellness aimed at transforming healthcare for a better future. This program, funded by the Government of Jamaica, the European Union, and the Inter-American Development Bank, is focused on creating a more efficient and patient-centered healthcare system.
I'm Keisha Riley Harrow, Nurse Manager and Change Agent for the Health System Strengthening Program. Here with me today is Dr. Alafia Samuels, the Health System Strengthening Program Non-Communicable Disease Team Lead. We will be discussing the chronic care model, which is a part of this wonderful initiative that the Ministry of Health and Wellness has imparted on the Jamaican populace. Dr. Samuels, so glad to have you here with me today to talk about this wonderful initiative that is going to be transforming the healthcare of the Jamaican population.
Sure.
What exactly, though, is the chronic care model?
The chronic care model is not really something that we have created here. It's an international method of work in primary health care that has been implemented in a lot of countries, but not so much in this region of the world. We are accustomed to, both in the health system as well as the patients, the feeling sometimes is that you have a problem, you go to the healthcare workers and the problem is solved, and then you go home. So take, for example, if you have a ruptured appendix and you go to hospital, you sign the consent form and after that it's all healthcare workers. You don't really participate much in the surgery except to lie down there. But if you have diabetes, it's a completely different story. If somebody has diabetes or hypertension or other chronic diseases, this is something that really at the heart of it, the patient themselves has to partner with the healthcare workers to manage this disease. So we have actually had to think about how to change or how to adapt the healthcare system to better work with chronic diseases so that we understand that it's not a one and done business. It is something that you're going to be living with for the rest of your life. So it needs to be a partnership between the patient and the healthcare workers so we can get better outcomes.
Awesome. So how exactly will this affect the patient and the healthcare worker?
Okay, so with the patient, we really are interested in empowering the patient so that they can assist with their own management. So we want, for example, when they come to the health center, that they come with questions for the nurse or the doctor, that they come with maybe a record of what their blood pressure reading has been like over the past few weeks, and that they come and that we offer them tools and we offer them experiences that will make them have better outcomes and have a better interaction and a partnership with the health team.
I see that this is slightly different from how we have always been existing over the many decades that primary care and secondary care has been functioning.
Yes.
But given the many cultural and financial challenges that our patients face, how will this model, what is the level of support that this model will bring to the clients and the staff?
Right. So with the clients, we are going to be engaging social workers that will assist with some of the social issues. We are going to be trying, let me give you an example. So, you know, when patients have diabetes, they have lots of different things to do. And right now, the system, as you mentioned, they have to come 6 different times to get the 6 things done. That's really a strain on the patient, especially rural patients, and you know how the transportation is difficult and that kind of thing. So what we are trying to do is that we want to introduce something called a one-stop shop for patients with diabetes.
Wow.
So that they, when they come to clinic, they're going to spend the whole day in clinic, but it's better than going 6 times. When they come to clinic, they would see the nurse, they would see the nutritionist, help them with how they are eating and what they must eat and so on. They would see the doctor for the engagement. We would try and make sure they get the drugs same time, same place. If they have any blood tests to do, we would have somebody to draw the blood there. We hopefully would have the foot doctor or the community health aides, which are right now being trained in foot care, would be there to assist, and so on. So we really want to focus our healthcare system around the patient and make sure that the patient has the best experience.
Awesome. I'm loving what you're saying. However, once the patient leaves for the day, what will the chronic care model follow-up be like for that individual?
Right. Good, very, very good question. So, as you know, we are introducing the electronic health record in a number of health centers. There's 10 health centers under the project, and of course in the 3 hospitals under the project as well. What we want and what we are hoping to have, it's not in place right now, but we are working towards it. We want to be able to be in SMS contact with our patients, to send them text messages. So they would get a text message to say, remember your appointment is coming up. They would get a text message to say, your prescription is about to run out. Have you refilled your prescription? Or a text message to say, today's hint for healthy eating is drink more coconut water. That kind of thing.
Wow. And here comes the introduction of telehealth. I love it. I love it. I love it. However, if someone wants to know more about the chronic care model, where can they go for more information?
So we already spoke about the website. I think it's hsspmoh.gov.jm. They can look there. What we are doing in Jamaica is important, not only for Jamaica, but also for the region, because we want to be able to demonstrate success.
And as usual, Jamaicans are the lead for the Caribbean.
Egg in the red, we that.
That is so true. Thank you so very much for being with us today. I really look forward to the engagement and the rollout of the chronic care model. As a healthcare provider myself, I think this is long overdue, and patient-centered care is definitely the way to go.
Absolutely.
Thank you, Dr. Samuels.
Thank you too.
Awesome.